Now, when you say you are looking for a child, fruit of the womb, then a question you should ask yourself. You cannot say you are trying to conceive, there are things, there are investigations, there are lab tests you should do. Those lab investigations are just the baseline, the basic things you should do first. You must do it. When you must have, concluded after 1 year unprotected, having it with your partner, 1 year unprotected, and you still could not get pregnant. Now is the time to have these investigations done. Number one is history taking and examination. This should be done by an expert. Yes. This is a time whereby the medical experts, will ask you some questions, trying to know your cycle. How has it been? Has it been regular or irregular? How your menses has been? Have you been ovulating? The signs you are having. If you have any gynecological issue, if you have any medical issue that can, be a problem from you getting pregnant, so the medical experts has to put all these things into consideration. They need to take your family history to know in your family if anybody have had this issue of infertility, what caused it, what exactly happened. So all these things are the things you need to find out when you are trying to conceive. It's not even enough to say I'm not able to conceive. You should know why. That is the first question. Why? What caused it? So the medical expert or the gynecologist will have to examine you very well, find out exactly how your system is working, the problem you have encountered as a single person, as a single lady, or as a single man. All these things need to be documented, because some of the issues people face, when trying to conceive, are issues related to family background, lifestyle, and other things. So this is one of the things you need to find out. Examination and history taking, which should be conducted by a medical expert or your gynecologist or your midwife. Now, the next investigation you need to do is a blood test called hormonal profile. In this hormonal profile, you have to check for luteinizing hormone, follicle stimulating hormone, estrogen, progesterone, and prolactin. Because in some women, why they are not conceiving is because they have high level of prolactin. Prolactin is a hormone that is found in breast milk. That is why women who are exclusively breastfeeding don't usually ovulate and they don't usually menstruate. Some of them, if you are really breastfeeding exclusively, breastfeeding on demand, not when you drop your child, you go to work, you can now come back and say that you are doing exclusive breastfeeding. No. Those who are breastfeeding on demand, at least 12 times per day, that is the one I'm trying to refer here, they normally have increased level of prolactin that can inhibit the production of estrogen and progesterone. Then the next investigation is ultrasound scan. The radiologist has to do it to find out exactly what is going on in the abdomen and your pelvic, to know if anything is wrong with the uterus, that is the womb, the bladder, the fallopian tubes, the ovaries, if they are okay. The next one is HSG. Women are so familiar with this. I must tell you, this is not really a fantastic investigation, honestly. This investigation, that is hysterosalpingogram, it is used to check if the fallopian tubes are okay, if they are blocked. They have to inject a dye through the cervix to the uterus. When the fallopian tubes are not blocked, the dye will now have to spill through the two fallopian tubes. But when the fallopian tubes are blocked or one is blocked, it will not spill, it will not pass through the fallopian tubes. So it's actually a kind of a test to know the condition of the fallopian tubes. And once this once this procedure is being done, then they usually take an X-ray film to find out if the dye is actually coming out through the fallopian tube or not, if it's getting spilled out through the fallopian tubes. So that will indicate if the fallopian tubes are blocked or patent, that is, whether it's open. We have the one we call laparoscopy and hysteroscopy. It's just like using a camera to view through this uterus, through the cervix to the uterus, and to know the condition of the uterus, that is the womb. You know, is a kind of a mini invasive surgery, to find out exactly the condition of the reproductive tract. Then the next thing you should do, very, very important, is to check for infection. We usually do what we call cervical swab. They will use a speculum, put it, open up, and then use a swab stick to collect it. We usually check for chlamydia and gonorrhea. Very, very important. When you have all these things, you need to treat it before talking about conceiving, because they can prevent one from conceiving. Very, very serious issue. Chlamydia and gonorrhea, very STIs. Then we have another one we called AMH, anti-mullerian hormone. This investigation is done to know the amount of eggs that are still remaining in your ovary, to check if you still have enough or not. So your problem or the actual reason why you're not able to conceive will be known. So when there are no longer ovaries in there or eggs in there, the problem is now known. So it's one of the things you need to do. Then we have thyroid function tests, very, very important. When we talk about fertility tests, it's not a gender-based something. Both men and women need to do it. So as the woman is doing her own, the man is also supposed to do. Most of the problem we face with infertility are even coming from the men. Don't think when you have issue with infertility, it is only you, the woman, who have to go through a lot. No. Before we even ask you to do HSG or whatever, the man has to, undergo the whole investigation that he's supposed to do as a man. Number one, the man has to do what we call examination, examination of the testicles to check if they are really okay, if there are fluid or accumulation of anything in there. The man has to do examination. It can either be digital examination to check the state of the prostate and other things, and then semen analysis. Very important. You need to check the count, the shape, and the quality. Some are producing, but the quality are very low. Some are watery. Some the counts are very small. So all these things need to, you need to be sure of what is happening in your body before you can be able to say, oh, I'm trying, I don't know what the problem is. You need to know all these things. It is not a gender-based something. It is particular both for men and women. Everybody needs to do something once it has to do with infertility. I'm Nurse Prudence, a registered nurse, a midwife, and a family planning provider. If you have any question, ask me in the comment section. I'll be there to answer you.